Welcome to Medically Speaking, the UCLA Health podcast that brings you clear, compassionate conversations to help you make informed, empowered decisions about your health. You should not need a medical degree to understand how healthcare works or how to make it work for you and the people you love. I'm Glazier, and I'm so glad you're here. So today's episode is actually a personal one for me. Since I was a kid, honestly, as far back as I can remember, my dad would take me on walks and he would talk to me about what he would want if he found himself in a situation where he couldn't make medical decisions for himself. I was honestly probably only like 11 when these conversations started, and it felt like a lot. But as I got older, I really came to realize that these conversations were a gift. Because when the time came, when my brothers and I had to make decisions for him at the end of his life, we had, I would call it a compass. And we knew what mattered most to him. We knew what living meant in his eyes. And so because of that, we were able to honor his wishes with clarity, confidence, and love. And so today's topic, advanced care planning, is what it's really about. It's not just about documents and decisions, but about choices, values, and peace of mind. To help us explore this topic with the depth and warmth it deserves, I'm joined by three remarkable colleagues. First, we have Dr. Neil Wenger, a professor of medicine in the Division of General Internal Medicine and a national leader in healthcare ethics and advanced care planning. We also have Dr. Ann Walling, palliative care physician and professor of clinical medicine at UCLA Health, supporting patients and families through serious illness with clarity and compassion. And we also have Shawny Smith, an advanced care planning liaison at UCLA Health, who helps patients and families navigate these incredibly, deeply personal conversations every day. Thank you all so much for being here. So let's just start at the beginning. I have so many questions. And Annie, why don't we just start with you, if that's okay? In your own words, what is advanced care planning?
I think the simplest way to think about advanced care planning is communication. So I think you give such a good example just at the beginning of the intro to this podcast, really talking to your healthcare team and to your family about what's most important to you and how that might relate to various healthcare decisions.
I love the emphasis on communication because I think for a lot of people, their minds are instantly going to go to documents. So I love that really why it matters most and, what does it really mean is about communication. I don't know if you have any other thoughts, Shawny or Neil.
Yeah.
Go ahead.
I would add...
See how wonderful these people are?
I would add that it's communication about what's important to a person. So just as your dad was communicating with you about things that would be important to him in the future, that's what advanced care planning is all about. We have just a panoply of things that we can do in medicine today. We have so many things that we can do. And advanced care planning is how we target our tools in medicine to what people want.
Really, I love that. And especially the future part of it as well. And how you can talk about the future in the present and how that you can reconcile things that matter to you now in these future states. Anything to add?
No, he pretty much said it all. That was it.
Well, Shawny, maybe you can tell me then, is advanced care planning something everyone should be thinking about, even if they're healthy or young or don't have a diagnosis of something terminal?
Absolutely. I think everyone should have an advance directive. At least have the conversation, start off with the conversation so that your healthcare wishes can be documented and having in chart, or, your family would know what you want. I've seen situations where there's no advance directive in chart and family members, something happened to a family member and everyone wants to make choices, but it becomes like a big situation, like hospital setting, where one person is, I want this for my mother or my father, and someone else wants something else completely different. With that said, it's just a lot of confusion, and making sure we're honoring patient wishes. It's best to have it documented.
So, we were talking about planning, and then you mentioned the advance directive. So I just want to kind of help me understand a little bit. So there's the planning, the conversation, the communication. And it feels overwhelming, I think, for a lot of people, right? They're like, okay, someone's talking about a directive. Is that a piece of paper? Are these documents? So maybe we could talk about the core steps of that process and just break down a little bit. So what's the advanced directive?
So as you pointed out in the beginning, a lot of people think about advanced care planning as being a piece of paper, and it's not.
Right.
As Dr. Walling said, it's really the communication. But the piece of paper called an advance directive is an extremely important piece of the process. And it's important for a few reasons. One, it allows you to make a decision about who you want to make decisions for you legal. And sometimes we hope that it never matters whether it's legal, but there have been families in history where, in fact, they don't agree. And having something that's legal turns out to be really important.
Mm-hmm. And Shawny, too, you mentioned confusion. I think about things being hard, someone being sick. It's very, very hard to make decisions or talk about things in a crisis. And so it seems to me having a tool that provides that clarity, especially when there's maybe confusion or lack of consensus, right, among siblings, family members, that this legal document really helps.
Right. But it doesn't really replace the conversation.
Right.
Yeah, it's a basis for it. It's a way to pull together what this conversation included, and let's put it down in writing.
So maybe, and Annie, maybe you could take me through this. So what kind of things are articulated, though, in an advance directive that really, I guess, kind of maybe just paint a picture for me if, what's articulated. I gave you the example of my dad, but, a lot of people are worried about having a stroke, right? Or being in a capacity where they can't speak for themselves. So what kind of things are articulated in an advance directive?
Well, first, I would take a step back too and talk a little bit about the process of,
Please.
So for when I think the core part of advanced care planning is really getting to know someone as a person. I think most of us went into medicine because we want to help people, we want to make the world a better place. And the way that you do that is to really get to know people as who they are and what's their essence. And I think that helps with everyday in the moment decisions, but it also helps when, unexpected things come up in the future that makes things feel, just makes things better for families and patients when they're going through hard times too. And so having that, really getting to know someone and what really is important to them. And I think that is how we've sort of tried to gear the UCLA Health Directive, is to support that type of conversation. And I don't know if Dr. Wenger wants to talk a little bit more about the UCLA Advance Directive in particular.
Can I just ask you a follow-up question first, which is when you say finding out about the essence of someone, are you saying, family member about another family member? Are you talking about primary care doctor like myself about my patient, or palliative care specialist like yourself? Who's the you and them?
I think all of the above.
Okay.
I think ideally everyone would know each other in those really important ways, and that should be sort of the guiding light of care. I think the highest quality healthcare that we could provide is really guided by goals and values.
Really relationships, right? Yeah. Like you're saying with anyone. And sorry, go ahead, Dr. Wenger.
So an advance directive actually has two pieces to it. One is the legal part where you appoint an individual to make decisions for you.
Okay.
And who one picks is a pretty important choice. But the other part is what Dr. Walling was just talking about. It's what sort of goals does one have for the future? And in some advanced directives, and the UCLA Advanced Directive specifically, it talks about in the future, what do you hope that medicine achieves for you and helps you avoid? Things about future health states, which might sound complicated, but it really isn't. Are there situations that perhaps you don't want to end up in? That might be what your dad was talking about when you were 11.
And, my dad, full disclosure, was a physician. So he probably had a pretty biased, or just, his own perspective about, getting older, getting incapacitated. But I guess, Shawny, I would ask you, when you're talking to patients, how do you approach this conversation with them to assess what their goals are, not just for, if they find themselves in these states, but it occurs to me, how do you, that this is connected with what they value about living and their quality of life?
First of all, just really listening. Beginning the conversation. Sometimes it's, patients have gratitude that I'm calling. There's something on their to-do list. but it's like normalizing the conversation where they don't feel like I'm pressuring them. I'm like a salesman or, trying to get them to do something. So little step by step. So if I speak to a patient the first time, it might come across as like, okay, you know what? Thank you. I'm glad that you brought that to my attention, and following up with the patient. Also, it just, I would say normalizing and just having that conversation when you hear what they've been through or giving examples of what they've done, or what they've seen. I'm pretty much like a storyteller, so that helps. Yeah, storytelling, giving an example from myself or from someone that I've spoken to before, and it helps open the patient up and start, I think I need to fill out an advance directive, or you know what, I remember a family member went through this or that, and that's how I kind of like break those barriers, and we can go on and on about conversation, which encourages them to want to complete one themselves.
Is there a particular kind of story that you share to, help people kind of realize that this happens to all of us, or to help normalize? Is there a particular example you call on that kind of you feel like works especially well to?
I started with COVID, because we all went through COVID.
Yeah.
And it could have, took out anyone or, incapacitated anyone from, children to elder. So I used COVID as one of my go-to. Look what we went through with COVID and how some patients were admitted, unable to make the healthcare decisions, or, maybe we were on a ventilator. Who was best to make healthcare decisions for them, and how we were unable to connect and contact our family members on one floor where the patients were maybe admitted on another. That was one way if I was getting it across to patients, rather than feeling with just calling them and just explaining an advance plan.
Just like reading information.
And I was just going to say, I think one of the key things too is just the normalization that we all should do that. I have one. Everyone should have one.
Yes.
And I think that's really, really the key, is that this isn't something to be afraid about or worried about. It's just, and most people feel relief once they do it.
You're bringing up a question for me, because I'm guessing that if you, one of the three experts here, you get called or a patient is referred to the advanced care planning program, maybe you can take me through this, and then you're making a call. Maybe perhaps the patient already has a diagnosis, right? You're not just cold calling people, right? I'm guessing.
Right. In fact, Shawny's job is particularly important. Usually we wait for people to raise the issue, or perhaps we'll hand them a document and hope that prompts a conversation. But we know that it doesn't very often. Shawny actually makes calls to individuals who ought to begin to engage in this.
Okay.
That's not such a simple thing to do.
It does not sound simple.
But you've gotten incredibly good at it. How is it that you engage these people to want to do advanced care planning with you?
I think it's because it's something I'm really passionate about.
Yeah.
I enjoy talking to patients and just engaging. But, I'm a people person. So having that conversation, just starting it off, where it might be patient just giving a little pushback, but just going on and on, listening, just the listening, and then just jumping right back into it. I get a lot of patients like, I was not going to fill that out. Go ahead and send me the form.
Oh my gosh.
So I do turn that negative into a positive, and I turn them around. And they'll remember me when I call them back or follow up.
No, that's a real talent for connection. But it sounds like you're also helping people then connect with themselves, right? And then identify within themselves kind of their goals and wishes. And it's really helpful to hear about kind of how to normalize the conversations. I mean, I do have to say, I think for a lot of people, they're like, where do I even start having this conversation? So I will say the three of you are accustomed to having these conversations. You're very comfortable with this topic. I mean, I'd love to hear, where do you recommend? Again, I'm a primary care doc, Annie's up the street, where would you recommend people, since it sounds like what you've told me is that everyone should have an advanced care, do some advanced care planning, have a directive, irrespective of whether they have a diagnosis or not. I have one because I do not like making decisions in any sort of crisis, right? But do these conversations have to start in a doctor's office or with a professional? Dr. Wenger?
They certainly don't. And in fact, we would love for someone to take an advance directive, read through it, say, well, I really hadn't thought about these kinds of things before. Maybe I should think about them. Maybe I should talk with my family member about it.
Right.
Then we'd love to have that partially completed or perhaps completed advance directive brought into a doctor's office to sit down with their primary care doc. Or maybe they mostly see a pulmonary specialist.
Right.
So they bring it in and say, I've thought a lot about this, and this is what I think. The ability to spend a few minutes going through an advance directive with a patient, listening to what they're thinking about, listening to what they're worried about in the future, and they get to understand that you as their doctor are going to follow their preferences, that you understand their goals. And most importantly, there's an opportunity here for them to realize that as things change in the future, they can bring up this topic.
Yes.
It's an open topic, one that can be revisited on a number of occasions.
I think that's an incredibly important point. I find it very comforting and reassuring, which is to say, while this is a legal document, right, it can be changed, right? And this conversation is something that needs to be continuously talked about and revisited, right? I mean, we change and evolve, right? And again, maybe you get a diagnosis, right? That then you changes again, particular goals. Have you experienced that where, people might articulate some goals and wishes and then change their mind?
Yeah, I know that I made some slight changes to my advance directive. For example, after my daughter was born, I kind of saw the world in a slightly different way, and my own preferences changed a little bit. I think some people might see changes. One of the things is that the patient's values tend to be stable across time, but you can change the document, and definitely there's changes in relationships and who you might want to list as your decision maker. That's something that we often update over time as well.
So, while you're talking about, I guess, documents, I've heard of something called the 5 wishes, documents. I was wondering if one of you could take me through that for our listeners.
So the 5 wishes is a particular kind of advance directive.
Okay.
It's worth realizing that within a state, just about any advance directive that's valid in that state is accepted. And in California, we'll accept a valid advance directive from any state.
Oh, that was one of my questions. Great.
So 5 wishes is a national version of an advance directive.
Okay.
You have to pay for them, so we don't hand them out a lot. They are fantastic as a tool to cultivate a conversation among a family. So we actually have a stash of them in the internal medicine suite. And if a family wants to have a conversation, we'll hand them one.
Oh, it's nice. So like a guiding post then for the conversation. If you don't have Shawny, right?
If we don't have Shawny.
Here's the 5 wishes. Okay. Also, and I see that Neil has the bright pink form, which I know is a POLST form. I say POLST knowing it's an acronym, and I actually have no idea what it stands for. But could you take me through the POLST form, because it seems like it's a related document to our conversation?
Right. So the POLST, Physician Orders for Life-Sustaining Treatment,
Great.
is a document that's available in almost all the states. Sometimes they have different names. Sometimes they're different colors. The one in California is pink. It's thinking about what kind of care one wants toward the end of life, but it's not an advance directive.
Okay.
And actually, for most people, a POLST is not the right document. It's particularly a good document if a person wants less than fully aggressive medical care in their current health state, the way that they are now. And that's true for a lot of people, but not the vast majority of people that we see. And it's different because it's actually a doctor's order.
Oh, okay.
It's a pretty remarkable thing that you can get a doctor's order and take it with you wherever you go.
Like a lot of people put them in their refrigerators or put them attached to their refrigerators, right? Can you tell me why?
Well, the reason for that is so that it's visible so that if emergency personnel, come into your house, they'll know where to look for it.
Okay.
Be sure to respect your
wishes. There's delineated orders on there. I see. Okay.
although that might stop me from opening the refrigerator, which would be a good thing.
Never mind. Okay, so that's helpful, but it's not an advance directive. Okay, can you maybe provide an example of when someone, or maybe you don't, but would you recommend someone filling a POLST form out?
Right. So we actually don't recommend that patients fill out a POLST form.
Okay.
It's signed by the patient,
Okay.
or if the patient can't, the appropriate proxy for them. But the POLST form should come from a doctor-patient conversation where you reach a conclusion that, gee, the patient really would want, say, comfort-focused care, or care that wouldn't include something like resuscitation. That's the perfect time for a POLST form.
Okay.
Because the POLST belongs to the patient. And if they go to a nursing facility or a rehab facility or back home again, the POLST goes with them. That conversation will then direct care wherever they are.
Okay. But it is, so do you still put it in the portfolio of planning?
For sure.
Okay, terrific. That's really, really helpful. I do think that a lot of our patients, my friends, my family have, they're not necessarily myths, but maybe some misconceptions, I think, that would be helpful to clear up a little bit. And I'd love to know, Shawny, what do you say to someone who says, I'm hearing you're talking to me about an advanced, directive, but I think of that as giving up?
No, absolutely not. It's just, it's beginning a conversation of, in the event, if something happened, what would you want? Just making sure we're honoring your wishes.
Yeah.
Making sure that we're not taking on, the hospital's not giving measures that maybe you want or do not want. Making sure you have a voice if you are unable to speak. That's pretty much
I love that. I think that's something to emphasize, right? Like, we're carrying on your voice and we're honoring, right, what you want. A lot of, I think, people also say, well, listen, if I tell my spouse, my partner, my doctor, that's enough. And I guess, Annie, what would you say to them if that was their concern? If that was their statement?
Well, tell me more.
Yeah.
That's...
I love it. I love it. It's the emphasis on the communication, right?
Yeah, it's really, because I don't totally understand what they mean by that.
Yes.
So,
Yes.
Give me more information. I want to know, tell me what you're worried about.
Yeah.
Let me help you.
Mm-hmm. Right. And if they know the plan, tell me the plan, and we can then codify it, right? And, cement is, I think, too strong a word. And I think that's important, right? Is that these things are changeable and we can always revisit them. But yeah, let's make sure that we all have the same plan. And again, that speaks to, I think, the communication. I think, again, and I'll just ask it again, because people say this all the time, that advanced care planning is only for older or sick people. And what do you say?
Yeah. It really isn't. It really can be done at any age. It certainly takes on greater importance as one has an illness, that especially an illness that might progress. But decisions about whether someone wants to be kept alive in a future health state of one sort or another, it is really relevant to all of us,
Yes.
Especially those of us who drive LA freeways. It's really quite important.
Right. Things happen. It also occurs to me that these conversations don't occur in isolation. Again, I was telling you, my father was a physician and I myself is a physician. So we were having when I was 11, I was already a physician. No, but we were already having a particular, type of conversation. But I certainly have, remarked that culture, religion, family dynamics, language really play a role in these conversations and decision making. And, Shawny, maybe I could start with you. Maybe you could give me an example of any barriers that you've seen, maybe emotional, cultural, that might be challenging as you sort of try to persuade someone to engage in advanced care planning.
I've come across a lot of cultural, where maybe the family member, the elderly family member is, in their culture, they don't write down their wishes. They just only tell one particular person.
Okay.
So trying to get them to, share that name of the person or complete the advance directive, sharing it with their family members, their younger family members that are taking care of them, that helps. The community sessions help.
Oh, tell me about the community sessions.
Well, UCLA offers community sessions about advanced care planning. So if, what we're talking about, you have more questions, we have monthly community sessions where we go in more depth about what advanced care planning is and how to fill out a form and how to start that conversation. And it's all available on our website.
Okay, great. No, and we'll definitely point, our listeners to it. Do you find that people show up and ask questions?
They do.
So what's one of the biggest questions you get?
Well, they range from, I don't know how to start filling out this document, or I'm afraid to raise this topic with a family member, to really detailed issues about, I have 5 children and I want to make them all my healthcare agent. Is that a good idea or not?
And what do you say? What do you say to that one?
To that one, I say, do your kids get along? And the response was, oh, not at all. I said, that's not a good idea. But actually, in these sessions, and they'll range from just a dozen people up to like 50 or so, and they're by Zoom, so people feel pretty confident in being able to ask questions that they want. They don't have to reveal who they are, although usually they do. And usually they tell us a lot of things that maybe we would prefer not to know. But they talk to each other. Right. And they talk about how, I had that experience and this is how I dealt with it. I think it really prompts a lot of good advanced care planning.
No, it does. I think that, and all these, that's how people remember, I think, this information. It's a lot. I mean, listen, we have a wonderful advanced, directive. We have wonderful brochure and information, but hearing your community, your friends and family talk about this and hearing their questions, I do believe, and you mentioned, narratives and stories. I think it really helps people attach and retain, the information.
Yeah. Sometimes people aren't even sure what questions to ask. And so I think coming to the community sessions, hearing the questions other people have, I have that question too. So I think we all learn from each other. I mean, that's one of the cool things about our work is that we're always learning.
Yeah, agree. And learning about each other. Any other, kind of big barriers or challenges, though, that you've seen, again, kind of just culturally or religiously that have, something common, I think they're just that we've come up against that is just helpful to approach and kind of move past?
There are a lot of barriers to getting people to talk about the future just in general.
Yes.
And especially about the future at a time when decisions may need to be made about life and death. We have a lot of individuals who want some other person to make all decisions for them. And under those circumstances, it becomes a little bit complicated because our goal really is to achieve an individual person's goals. What would they autonomously want? If they're going to hand off everything to someone else, how do we know how well that person knows what they want? So we would actually try to get them to come in with their family member and have a conversation in the office together. That's where advanced care planning really happens.
I would imagine that this process would also just invite everyday reflection, right? So even in this process, I hear that you want all these decisions made, but actually, step back and reflect, like, what matters to you, right? So it's not just like what matters to you in the future, but am I imagining that just maybe it also invites people to sort of say, let me think about how I do define my quality of life, or what do I love about being alive? And
yeah, absolutely. I think it's a continuum.
Yes.
Because I think if we're always constantly thinking about what matters most, we can make choices to make our quality of life every day the best it can be. And so I think it's basically just thinking about that, now and for the future.
Right. And in fact, it's a way of making explicit that what we're aiming for is shared decision making. Now, this is a special kind of shared decision making looking toward the future. But if in fact in that doctor-patient relationship, the expectation is the patient is going to be fully informed and make decisions that are real possibilities with their clinician, with the support of their family, that's really what advanced care planning is aiming at.
I love that you mentioned shared decision making. We had Dr. Chris Saigal, and we were talking about shared decision making in urology. But I would love for our listeners, can you define a little bit more about what shared decision making is?
So shared decision-making means understanding fully what's happening clinically and then bringing one's personal values to decisions that need to be made given that clinical reality.
Do you think medicine has always been like this?
I think that medicine was a lot more paternalistic in the past.
I think so.
We have moved toward trying to make sure that autonomous choices are what we do. But that only happens using communication, as Annie said.
Yeah, and continuous communication. It's not just like an episode.
Well, and because there's constantly new innovations, and so there's more and more options. Right. And so that also brings the need for really shared decision-making because we have choices, which is a great thing.
I want to point out one other thing about that is that UCLA has this infrastructure built where this communication gets documented in something called a goals of care note. And that goals of care note is there for others to look at.
Yes.
And medical care is really complicated, right? The primary care doc may not be there when important decisions need to be made, but the hospitalist in the hospital or the specialist doing a procedure can look at a goals of care note, know what was discussed before, and take off from there with their conversation.
I think that's incredibly powerful, right? So wherever you are, let's say in a UCLA health system, as an example, there are other health systems that have, an electronic health record. It almost is like your goals of care are part of your identity. Right? So wherever you go, it's like, here's my address and here's my goals of care. I certainly would want all of my healthcare team to know that about me.
For sure. And in fact, the kinds of things that you want are what ought to be driving the care that you get.
Yes.
So why do we need a surrogate under those circumstances? Well, because little decisions need to be made along the way. And we probably didn't talk about those. But if you look at the UCLA Advance Directive, before you write down who you want to help make decisions for you, it says on top, we're going to follow what you want.
Yes.
And if there's more questions, who is it that we turn to?
So it's interesting, even just the order, we don't say who's your healthcare proxy right away. But speaking of which, because I neglected to ask you all, can we talk about a healthcare proxy or a healthcare agent, what that means and how that person is appointed? Sure, Annie, I'll start with you.
So it's basically someone that you choose to make decisions on your behalf based on information that you've shared with them. In the setting where you're not able to make decisions yourself. Okay. So, I'm thinking like when I had to have surgery, for example, I wasn't able to make decisions at that time. So the person who I designated made decisions. So it's that's the scenario. And so if it's documented in a UCLA Advance Directive or any Advance Directive, it's legally appointed healthcare agent.
Right. Is that some of the conversations you have to have, Shawny, as well?
Absolutely.
Okay.
Designate healthcare decision makers. Also create the goals of care notes for patients as well. And while they're in the process of completing their Advance Directive, or if someone passed away, when I review their Advance Directive that's been dated 5 years or older, I'll update decision makers if needed.
Great. Great. That just seems so essential.
Yeah. I mean, you want to pick someone who's going to be able to reflect to the doctors what it is that you want. Right. And some family members may do that better than others. And I think you probably want to pick the one that's going to do a really good job.
Or all 5 of them.
Or perhaps all 5 of them.
And once you pick them, you should make sure they know what you want.
Yeah. Having that conversation is really critical.
Can you think of, I think for a lot of people, right, the future horrible diagnoses, it just feels very abstract. And I would love it if, Shawny, we could start with you. What's a specific example perhaps of a patient where you really saw your conversation, the engaging in advanced care planning, make a difference for this patient as they kind of went through, the course of an illness, let's say, and for any of you, or all of you?
I've had a patient, I was just sharing with the doctors. She had no healthcare decision makers. She didn't feel like she should have an advance directive because if she passed away, she had no family, she passed away, she didn't care what happens. But talking to her and just going over questions and then her sharing like what she's going through in her life, I turned that around like, this is why you should have an advance directive. This is why it's important to have an advance directive. Do you mind if I send you one? So I kind of broke that barrier, mailed it out to her, and I called her. We actually went through question by question together. I Googled her zip code.
Wow.
I found a notary, and she completed and turned it in, and she made sure she gave me a call. So just how important it is, but sometimes patients feel like, I don't need that, or I don't care. They do care.
They do. It sounds like you got her to care about herself.
I did.
Right?
Well, and I want to point out, too, that Shawny really helps with some of the practical barriers.
Yes, which are real.
Yeah, she mentioned notary. So that's one of the pieces of the advance directive. Since it is a legal document, you can have two witnesses sign it or have it notarized. And so one of the things that we've been working on to try and make it easier to complete them at UCLA is to have notaries more easily available for patients. But Shawny's able to help patients navigate
navigate that. Yeah, because even a step like that feels very insurmountable. I mean, I'd be like, I don't know how to get a notary. I feel like I remember every time I drive by UPS and then I'm like, make a note. And then
everyone's so busy and there's limited hours. And
you just dismiss it like, okay, that's on my to-do list.
Okay, but doable. I think that's the take home about that. The notary is doable, even if you're not at UCLA. I mean, Dr. Wenger, what about you? I mean, I'm sure you've had multiple examples where you've been able to see, where advanced care planning has made a real impact for a patient and or their family.
Oh, there's no question that those conversations that then get translated into a goals of care note, when someone gets critically ill toward the end of life, if you have had these conversations before, the doctors are all on the same page and know what direction to go in for this patient. A relative, perhaps an estranged child, may fly in from across the country. They have very conflicted views about what to do now at the end of life. They're not ready to let go, but the patient may very well have been ready to let go already. If we know what they want, and we have, especially if we have a completed advance directive, we can help the new visiting child.
Have you seen that before? Have you seen that example?
All the time.
All the time.
Yeah. Yeah. And so it allows people's goals to play through.
Yes. And drive the decision, or sometimes supersede, right? Maybe one person's kind of emotional.
And not only that, but it helps everyone to know that this really is what the patient would want.
About them.
Therefore, I can go along with it, although it might not have been my choice.
In that example, I think it takes the burden away from that family member.
Yeah. Annie, what about you, though? I mean, can you think of an example where you really saw, I mean, you've chosen to be in this work as long as I've known you, but I'm sure there's a lot of examples, but do you mind sharing one where you really saw kind of the power of having a plan, or even it's not even just the power. I feel like there's so much generosity towards yourself and your family member.
Well, I have a hard time thinking of just one example because it's
your life's work.
Yeah. It's basically, to me, it's just an ongoing conversation of patients just really understanding, like for patients who are dealing with a serious illness, to really understand where they are.
Yes.
And every step of the way, understand their treatment options, make sure that aligns with what they wanted, with what they want, with what their plans are. And so I just feel like it's just such an integral part of high quality care.
Yes.
It's hard for me right in the moment to think of one.
Well, that's a really good point, too. I think, and I really want to emphasize this for everyone, which is this isn't something extra. I think we're all saying, like, this is actually part of your everyday healthcare, right? Is this planning, right?
Absolutely. Absolutely. And everyday healthcare for people that have everyday problems and have really special problems. Special medical problems. So a point that you raised earlier, I want to emphasize a little, and that's that an advanced directive or advanced care planning is not just for people who maybe would want more comforting care in the future. It's super important for the person who wants every possible new innovative treatment that's available. And we have a lot of people come to UCLA who are coming to get really advanced, highly technical care. For that individual, we need to know that. And we also need to know, what if that technical care doesn't achieve their goals? What is the goal you want to be achieved? And what would you want done in the case that it can't be achieved? Therefore, we can follow what you want under all different circumstances. So it's not just for the person who wants less than fully aggressive treatment.
Yeah, that's an incredibly important point. I mean, and it was just always bringing it back to center, which is you, the patient. I think that's a big question. We are going to go to the Asking for a Friend segment where we explore all the kind of questions that people have. You probably hear these in the community settings, but often where people feel too shy to ask, or they just honestly just are unsure. And I asked this, but I just want to emphasize this. But a lot of people had the question, what if I change my mind after I've just filled out this Advance Directive. I finally got the notary, and then 2 years later, I want to change it.
Change it.
It's okay, right?
Absolutely.
Okay. So and I love the continuous communication. I mean, I think it's interesting that our probably core values are not static, but maybe stable within us. But there are going to be nuances that we have to be, flexible about.
For sure. And as Dr. Walling pointed out, the things that most often get changed are who you would want to make decisions for you. Perhaps the person you chose is no longer available. But the things that we don't see change that often are people's values. If someone tells me, listen, I want to keep going as long as I possibly can. But if I'm in a place where I can't communicate with loved ones, under those circumstances, I don't want to be kept like that.
Yes.
I have never had someone say to me, I thought about it, and I'd like to be kept alive as long as possible, comatose. I don't think that value changes, although one could if one wants.
I mean, I completely agree. I don't think that value changes, but I think unless you ask the question out loud and then answer the question out loud, then no one's going to know.
Correct.
Right?
That's why we do this.
Right.
Yeah.
I mean, you could, I think a lot of times you're thinking about this in the middle of the night, anxious or freaked out, or you hear like a terrible story. But, I think that's the real power of this conversation, which is to say, no, I'm going to ask you this out loud. We're not afraid of these questions, clearly, right? And, but try to be less afraid of the answer. And actually embrace the answer.
And actually, if you don't ask the questions, it's very hard to predict what an individual is going to tell you.
Right.
And there are some circumstances where we know the questions we need to ask. It's extremely important for someone that has early cognitive impairment.
That's my next question.
If they're going to go on to develop dementia, we need to know the things that frequently happen to people as they lose their own abilities to make decisions. And one of the most important things is, would they want a tube to keep them alive if they can't swallow well enough? And
you mean a feeding tube?
A feeding tube, and couldn't communicate with us. If you don't ask that question early on, you lose the ability to ever ask the question.
And I'm guessing a lot of people, who aren't in the medical field wouldn't know to even ask that question, wouldn't know that comes up. So you have to have some learnings and someone to explain to you kind of what often is the course, right, of a certain condition, and then ask you how you feel about it.
That's a really good point about if you do get a new diagnosis, to really have a good understanding of it and ask all the questions. And that will help you think about what's important to you.
Yes. And that changes too. I mean, I've had both my parents, had cancer, and how they felt about day one on the diagnosis was very different, right? 6 months later. So again, to your point, the continuous communication. I think with the cognitive impairment, I do get this question, which is, can I complete an advance directive if I've been diagnosed with, cognitive impairment? Is that a tough one?
Well, I would say you have to have decision-making capacity to fill out a legal document. I think that's just, and so it really depends on whether you have decision-making capacity.
Yeah, and one's doctor can help ferret that out. Under rare circumstances, we might get a consult from a neurologist or a psychiatrist to help us figure out whether a person has capacity or not. But I would say 99% of the time, one knows. And if you're capable, we want you to complete your advance directive
Terrific.
before you lose capacity.
Right. And we're always here for the conversation. Well, at least the three of you are. This one comes up. You mentioned the 5 wishes being a national document, but you also mentioned having to pay for it. But if I fill out my advance directive in California, is it valid? Like if I cross state lines?
Just about any state.
Okay. Great.
And I wanted to mention, so we have the UCLA Advance Directive, and then there's also the California Easy to Read Advance Directive, which is on the Prepare website.
Okay, great. And we'll post all of these links. Yep. And in multiple languages, I see.
Yeah.
You have it in Spanish and in Arabic.
Okay, terrific. And I'm guessing, too, if we needed other languages, we could easily translate them.
Right.
Yeah.
Well, the Easy Reading Advance Directive is available in 12 languages.
Fantastic. Okay, fantastic. So before we close, I did want to return to that idea of a compass, which I think all of you provide for your patients, and how I felt personally, having my own experience. I'm just going to ask each of you, what's a message or an insight or a practical takeaway that our listeners might take away from this conversation? And Shawny, I'm going to start with you.
Complete your advance directive.
Okay.
Ask questions. Start the conversation.
Okay.
That's what I would suggest to patients.
I think that's so wise.
Reach out.
Reach out. Okay.
Reach out.
Okay. Great. Annie.
I would just come back to the first thing I said was just communication. So talking to the people you love, and to the people who are part of your healthcare team about what's important to you. I think and really using that as like the guide for advanced care planning.
Okay. Wonderful. And I'm guessing it's never too early to start.
Never too early.
I just want to say to everyone, I hand these out to all my patients and I say, listen, I give this to everyone. Honestly, I give it the same way I say, listen, I'm getting an HIV test on you. We give this to all patients irrespective of risk, like it's completely normal. Same thing. Here's your advance directive. Please read about it now. I don't think you're dying. Dr. Wenger, any last minute thoughts from you?
That it's a natural part of medical care. And it ought to fit in with everything else that we do.
Yeah.
It's a really important piece that we shouldn't leave out.
Yeah. It's life care. I mean, I was really struck by your story about the woman who you spoke with who was like, well, I don't have, anyone else who's, going to be there. Well, you are just as important, right? And we want her to be treated how she wants to be treated, right?
Exactly.
Every step of the way. I think, I was thinking about while you were all speaking and, just speaking about the conversation and starting it, and it's for everybody, that this doesn't have to happen, right? These conversations don't have to be started in a doctor's office, right? Or even on a phone call. And I think from family members, everyone, you can even use this podcast and say, I listened to this podcast, made me think about what matters to me. Most if I were seriously ill, or again, I couldn't kind of make decisions for myself and just want to talk to you about it. So it can just start at a kitchen table, like a conversation like this. Absolutely. And that's actually why. So Shawny is part of a study that we did at UCLA. And we were able to show that just a phone call, a little bit of outreach, and having an advance directive available to you can stimulate a conversation between a patient and their family members that then continue on back into the office. Yes. That turns into advanced care planning that can affect the care that you receive. Just good old planning. It's a conversation starter. It's a discussion, and it's not a contract, right? Correct. I mean, it's a document. Well, no, but I mean, but the first conversation, right? Like we're just talking at the table, right? Like, and then, yes, of course, then thankfully it's a legal document. I really can't thank the three of you enough for your time and your stories, your deep commitment to this work. I do want to make sure I asked you everything that you wanted to be asked. Is there anything I forgot or anything else that you want to kind of convey to our listeners? We will point everyone to, our wonderful websites and resources and links. But anything I didn't ask you that, you wanted to talk about? I would say don't be bashful in bringing up this topic with your doctor. Great. I love it. Don't be bashful. Yes. In general. Okay, don't be bashful. No, I love it. That's the tagline. Wonderful. And again, you mentioned honoring, and it really occurs to me that while we're talking about sometimes end of life, or we're talking about, challenging times, that advanced care planning is really about honoring who you are today and honoring the human experience, and really making sure that your voice is reflected, it carries on your vision of what it means to live well, right, in good times and in kind of those more vulnerable times. So I do want to say to our listeners that, if everyone wants to start the conversation, take the step, learn more, we do have our website, uclahealth.org/advanced care planning. A lot of helpful tools, a lot of helpful information. And if this conversation, meant something to you, we hope you share it with a loved one, a friend, a family, and especially your healthcare provider. And as Dr. Wenger said, don't be bashful.
Talk about it.
Let's talk about it.
I'd love to have you at one of our community sessions.
Okay, how can you resist this group? This is so fun. Thank you for listening, everyone, to Medically Speaking. And until next time, take care, stay curious, and be very well. Thank you all so much for being here.
Thank you.
Thank you.